These are our neighbors. These are our family members. Medical debt is not something you can see when you look at somebody, but it's something that weighs on them very heavily. And we've heard in our office stories of people who are burdened and struggling to overcome what medical debt has done to them. People like Patricia in Hazel Park, who had a procedure, but then was notified until after the fact that it was out of network. She got hit with a huge bill. Michael from Ann Arbor told us he got a cost estimate for a procedure that was less than half what he actually ended up being obligated to pay. And he still has never been explained why. And Thomas from Holden Lake said that his medical debts are the biggest expense that him and his wife carry, besides childcare, which is also expensive. We're doing something about that too. What this all means is that medical debt is harming these people's potential. It makes it harder to get a job, harder to put food on the table, harder to afford the medicine you actually need, harder to make the choices that you need to make. And this debt happens to someone through no fault of their own. None of these people made a mistake. None of these people did anything wrong. None of these people took anything from anyone. But this medical debt was forced upon them. And that's why it's so important that we find pathways to forgive people of this burden. Today, we're excited to make progress, but the problem is not going away. Right now, hundreds of thousands of Michiganders are in danger of falling into medical debt for the first time, or even deeper medical debt than they have right now, because of what has happened from President Trump and Republicans in Congress. The cutting of Medicaid that will put 5.4 more million people across the country into medical debt. Every Republican member of our congressional delegation voted to gut Medicaid and SNAP and do this to Michiganders. A $700 billion cut from Medicaid. 500,000 people who could lose their health care. 30% of Michiganders get their insurance from Medicaid. Now, we're not finished. There's work that we must continue. And Governor Whitmer and I, and all of our allies, will continue to fight every single day to protect and expand access to quality health care, to prevent people from getting into medical debt in the first place. Now, we just believe that getting sick, getting hurt, needing help, that should not burden you with debt for the rest of your life. It shouldn't be a hindrance on your potential. The reason to get healthy is so you can do more. All of us have access, should have a right to the access to that dream of health and wealth. And that's taking this step to remove this burden of medical debt from so many people will help us get there and get there faster for more people and more communities. So I thank all of you. I thank this entire team. I thank the whole coalition. I thank the legislators. I thank the folks who have demonstrated what this looks like in parts of our state. Thank you for laying the foundation. We have more work to do, and it's work that we can do together. So with that, I want to introduce Allison Sesso, the head of Undue Medical Debt.
Thank you so much. I am so grateful to be here. I want to thank the Lieutenant Governor for those amazing remarks and putting the truth about medical debt and how it impacts so many people and what we're facing on a national level because of those cuts and putting it in that context. And of course, thanking the governor for her leadership. We've also been partnering with Wayne County. We've also been working with Oakland and Kalamazoo, and together we've been able to eliminate $182.6 million of medical debt here in Michigan. So I'm happy to say that there'll be 271,000 people that are going to benefit, and we're just getting started. Those individuals will be getting letters from us signed together collaboratively. And I want to make sure people believe those letters, which is why it's so important that we're here today and we have so much press here telling this story and making sure that people know that this is no scam. Indeed, it is real. One of the things that we say in that letter is we ask people to tell their stories of medical debt, because as we've heard here, it is no fault of a person as individual. They didn't do anything wrong. Something happened. They got sick. We're all vulnerable to getting sick. We're all going to get sick one day. The number one predictor of whether or not you end up in medical debt is whether or not you get sick. It is not related to your insurance status or anything else. That is a sad reality. And the truth is, the situation that was already bad is only going to get worse. Those Medicaid cuts are going to make it not only hurting the individuals that are going to end up being uninsured largely, but also it's going to increase the price of medical care for everybody else, because we need people to be in the pool in order for it to be cheaper across the board. And so just because you don't have Medicaid doesn't mean that action is not going to hurt you. And I want to make sure everybody is clear about that and clear-eyed and understands what this means. On top of that, there was supposed to be a law that was going to be implemented at the end of this month that would ensure that medical debt would not end up on people's credit. That law is now not going to be put into place. And so not only is there going to be more medical debt, but it's going to be worse for people. The impacts are going to be worse. But I'm happy that there's leaders like Senator Anthony that are not only doing this work with us and being champions, but also to get rid of the medical debt, but also looking at other legislative solutions that can help reduce the impact of medical debt, and that the conversation is really happening. I do want to tell you just a little bit about our work and who we are. So we're a national nonprofit that eliminates medical debt across the country. We've been able to get rid of $20 billion of medical debt, believe it or not, in our short existence. But there's at least $220 billion of medical debt out there. And this is not a final solution to the problem of medical debt, but it certainly is a good solution for the people that are impacted today. And I'm really happy to bring that here. People wonder, how are we able to do this work? We get rid of medical debt for pennies on the dollar. We are mimicking a for-profit debt buyer, except when we get rid of that debt, we don't follow up and say, pay us something back. We'll come into a payment plan. We say, your debt is free and clear and you no longer owe it. And so that's how our model works. People say, is this magic? No, it's just math. There is a reality that medical debt can be bought for pennies on the dollar. $1 relieves $100 of medical debt on average, and that's what we're bringing here. So it's a great return on investment, a really solid investment by the state, by the counties, and by lots of donors across the United States. So I am thrilled to be here. I want to thank all of the providers that have worked with us. We don't do this by ourselves. We need the hospitals to work with us, and many have. Across the country, we've worked with almost 400 hospitals, and we've worked with some here, and we're continuing to knock on those doors and get other hospitals to work with us as well. They understand also that this issue is preventing people from going to get the care that they need. They realize that while they have many robust features in place to prevent medical debt, financial assistance policies, charity care policies, that more needs to be done, and people still get caught up in it because the system is broken for hospitals as well. So thank you so much for the opportunity to be here today. I am thrilled to have the governor come up and talk next. Thank you.
Thank you. Thank you, Allison. Hi, everyone. I'm really excited to be with all of you today as we erase $144 million of medical debt to nearly 210,000 Michiganders. I want to start off by thanking our partners in Wayne County, Oakland County, Kalamazoo counties. Together, we've worked with Undue Medical Debt to make sure that Michiganders are not drowning in their unpaid medical bills. I also want to thank all of the advocates and legislators who have been fighting to relieve Michiganders of their medical debt. I especially want to thank Senator Sarah Anthony, my senator in Lansing, for her leadership in the legislature on this issue. Your commitment and dedication to Michiganders has really paved the way so that more people can get ahead. Today's announcement was made possible because of Senator Anthony's hard work and so many folks in the legislature and stakeholders, and so thank you. I want to also thank Developing Kids for hosting us as we make this exciting announcement. Today's announcement, I think, is something that is going to give so many Michiganders relief. Across the United States, medical debt is the #1 cause of bankruptcy. It affects more than 100 million Americans. There's 330 million of us, 100 million have medical debt. Across the United States, this is a pain point for so many, keeping them from getting ahead. It includes nearly 700,000 Michiganders who have to choose every day between paying off medical bills or simply putting food on the table and paying their utility bills. But here in Michigan, we believe that being sick or getting hurt shouldn't have to mean going broke. And that's why I'm really proud that the work of our administration has done to address medical debt and to support the financial and physical health of people across our state. You know, a few years ago, we secured $4.5 million in our balanced bipartisan state budget to relieve medical debt for hundreds of thousands of people. And earlier this year, in my State of the State address, I asked Republicans and Democrats to work together on bipartisan legislation to further reduce medical debt. Today's announcement supports our work, which is just getting started. So thanks to Undue Medical Debt, that's what we shortened it to. I don't know if everyone calls you Undue, but thank you. More Michigan families can now go to sleep without a pit in their stomachs and more money in their wallets. I want to share a story about Tammy Lake. Tammy is a mother and grandmother. She lives here in Michigan, and she's been living with diabetes, kidney failure, and arthritis. The cost of treatments for these diseases have left Tammy with so much medical debt, she wouldn't even be able to pay it off in one lifetime. That's where Undue has come in. They purchased Tammy's medical debt so she can focus on the things she loves, like spending time with her kids and grandkids. That's really what this is all about. So we can't stop here. This is a great announcement, but it is one of many steps we need to take. We need to keep this momentum and support Michiganders like Tammy, especially considering everything going on at the national level. I'm committed to working with our partners in the legislature to relieve Michiganders of medical debt that has been weighing them down. So I want to give thanks again to Undue Medical Debt and all the advocates and legislators who are committed to getting the job done for Michiganders all across our state. I now have the pleasure of introducing one of our partners in this fight, Wayne County Executive Warren Evans.
Thank you, Governor. All of us that are in public service tend to smile at things like this because this is really what we get into public service for. And the teamwork here has been wonderful. In Wayne County, we've reduced medical debt by $42 million, and we've gotten rid of the debt for 71,000 people in Wayne County. And it's amazing the tributes that you get from those people and understand the pinch that they've been in. One thing I'd like to mention, you don't, apply for the program, but you'll get a letter, and I think Undue Medical Debt talked about that once it's been relieved. Understand so many people are transient that you don't get the letter. So there needs to be some looking back at your previous address and check. It doesn't mean that we haven't retired the debt. It means you just haven't gotten the notice. But that's very, very important, I think, for people to understand. And the other thing is people are stressed by the medical debt. I mean, it's something that people carry with them, not just medical debt, but debt period. But certainly medical debt is one of those issues. And so the more we can do to reduce that stress, the better job we're doing. And the other thing is there are people who refuse to go get medical treatment when they need it because they're concerned about the debt. And there's nothing that we want to see eradicated more than people refusing to get medical treatment when they need it. And so I think this effort is a great one. I think it will grow. The numbers are significant now. And Wayne County still has money left. So the numbers I gave you are not our end numbers. The state's numbers are certainly not the end numbers. But I think all of us feel good about what it is that we're trying to do here. And when you work together as a team, you do get an awful lot more done. And speaking of teams, I want to introduce Senator Sarah Anthony, who has been a leader in the legislature on this issue and a bunch of other substantive issues. But every time we see each other, we smile about this one because this one is a winner. Thank you very much. And Sarah?
Good afternoon. I'm so excited. This is such a good day. It's such a good day. I have formal remarks. I will keep them today. Thank you, Governor. Thank you to everyone to be here just to celebrate this exciting step forward in combating medical debt. Our state is strong when our people are strong, when our communities are healthy and they're thriving. That's why in the very first month that Finally, Democrats had the gavel in the House and the Senate alongside our governor. We made a list. We made a list of the things that would transform the lives of people. And all roads lead through the budget. I always say that budgets are moral documents. You can tell me that you care about kids, show me the money. You can tell me that you care about roads. We need to show you the money, right? Okay. So there's so many things that you can say that you care about, but ultimately what you invest your money in shows us that it's real. And lowering costs for Michiganders has been near and dear to my heart and the hearts of so many in the state capitol. And we've accomplished a lot in the last 3 years, from universal school meals to protecting money for affordable housing. But while I'm incredibly proud of these investments, they don't mean much if people can't afford or access quality health care. And an unplanned, unexpected illness or accident is already stressful enough without having to worry about how to cover the cost. No one should have to choose between paying their rent and getting a surgery. Our Michigan residents deserve relief. So the $4.5 million that we were able to secure in the state budget has already paid dividends, in which you've already heard today. And we are just getting started. So in partnership with our governor, our lieutenant governor, and legislators on both sides of the aisle, we have started to work to continue to fix this broken system that too often puts profits over people. This year, we are proposing an additional $5 million in the state budget for medical debt forgiveness, extending relief to additional residents. We're also looking at this from a policy perspective. And I know oftentimes when you read the headlines or look at the news, you see so much division in government. But I'm pleased to report that the bills that we are already moving throughout the legislative process have bipartisan support. Because regardless if you live in a conservative community or a liberal community, medical debt affects everyone. And so I've been excited to partner with legislators both in the House as well as the Senate, and again, on both sides of the aisle, to address medical debt, not only through the budget process, but also through the legislative process. So we are working with folks like Denise Menser or Senator Lindsay to introduce bills to prohibit medical debt from counting on your credit report. Because no one should be forced into a cycle of debt and poverty simply for essentially getting health care. Together, we can create a future where communities are no longer weighed down by burdens of medical debt. We can build a system where health care is a right, not a privilege, and where everyone can access care that they need regardless of their financial standing. So let us stand united in this mission, because when we lift each other up and fight for our values, we create a stronger, healthier, and a more prosperous Michigan for everyone. So thank you all again for coming.